Prison health care costs have grown from $1.5 billion to $2 billion in 5 years, and health care staffing levels inside state prisons have more than doubled during that same period.
The increase was about $1 billion.
This was just one of the findings of the Assembly Committee on Accountability and Administrative Review, chaired by Assemblymember Roger Dickinson.
In California, we have about one staff member to every 14 inmates. In Texas, Georgia, other states, the ratio is 1 to 31. It's not clear at all what makes us so different from any other state in the union that we need twice as many people, literally, to take care of our inmates as they do in any other state.
In 2006, a 3-judge panel appointed a federal receiver to address major problems with California's inmate medical care. A committee investigation has found that the receiver's office was paying multiple consultants as much as $50,000 a month in salary and as much as $2,200 a month for renting an apartment in Sacramento, dry cleaning, and meal expenses.
We need to be rigorous about what we pay to consultants, how many consultants we have, the expenses that they're incurring, and make sure that those are required directly in the discharge of their responsibilities and duties.
In all, the state paid 8 firms more than $82 million between October 2007 and August 2010 to conduct construction planning, design blueprints, and other tasks associated with the goal of building 7 new prison health care facilities. But because of the budget crisis in the state, most of the construction proposals were scrapped in an agreement between the receiver's office and the Schwarzenegger administration. 3 firms were hired to do the same job, at times billing the state as much as $1.6 million a month.
We're cutting health care for children, for families, for women, those in need all over the state of California. So I think it's a fair question, while we certainly are committed to a constitutional level of care, that it's a fair question whether that care is expensive as it seems to be.
The committee's investigation also discovered that a 3-year contract with HealthNet to provide medical care outside the prisons, such as surgeries and other specialized care, had been signed. The terms of the contract and its fiscal impact on all California taxpayers is a mystery. The legislature and the public are not allowed to know the costs.
To be able to enter into a health care contract where taxpayers have no idea what the total amount of the contract is or the rates that are being paid by the state for hospital services is just not acceptable in these times. The public has a right to know when its money is being spent, what it's going for, and how much of it is being spent.
The Department of Corrections pressed in 1995 for legislation that created the rule to allow prison health care rates to be kept confidential, in part because they believed it would impact future negotiations if hospitals knew the current rates.
It's really an argument that's no different in principle than that made regarding any contract. Anybody knows as a competitor what might be paid for the past contract, what the competitors are looking at for prices for the current contract. We don't say if it's a road contract that we ought to keep the prices concealed until 3 years after the contract's done. So I think, in fact, that potentially we could have lower rates and better prices if people in the marketplace know what they're competing about.
The receiver's office oversight was the topic of the first hearing under the leadership of Assemblymember Roger Dickinson, who believes that accountability and transparency are keys to good governance.
This is a committee that has the opportunity to take a hard look at what we're doing in state government and beyond in California. I think that the time for oversight is certainly ripe, and we want to focus on not just taking a look at things that we think aren't being handled as they should, but also to identify how we can make them better, how we can make state government work better for the taxpayers and for the public, how we can achieve the kinds of outcomes and results that we want that will improve the quality of life in the state of California. This committee is a great opportunity to take a look at what we're doing and just see how we can improve it and do it more cost effectively and efficiently to the benefit of the taxpayers and the public.
This report was produced by the Speaker's Office of Member Services.